Good morning, and thank you for joining us this morning. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, the Chief Medical Officer of Health for the Region of Peel, and today, Sherry Lichterman, the City of Mississauga's Commissioner of Corporate Services and Chief Financial Officer, and also Acting City Manager this week. Since the beginning of the pandemic, the City of Mississauga has been a leader in implementing public health measures to protect employees as well as the residents that we serve. That's why today I'm announcing that the City of Mississauga is moving forward with a vaccination policy for all employees to ensure a safe working environment. This decision is based on scientific evidence and advice from the city's occupational health physician, as well as a review of municipal and broader public sector benchmarking and input from city councils, human resources, and legal services. As a result, Mississauga will join a growing number of public and private organizations implementing similar policies, including the City of Toronto. As an employer, the City of Mississauga has a legislated obligation under the Occupation Health and Safety Act to take all reasonable precautions to ensure a safe working environment for all staff. Vaccines are a proven and effective public health measure to stop the spread of COVID-19, especially the Delta variant. The City of Mississauga has hosted 2 employee vaccine clinics in our facilities to provide easier access to the vaccine for our employees. And we have consistently communicated with employees about the importance of vaccination. At this point, the City of Mississauga strongly believes that establishing a workplace vaccination policy is a key action that will keep employees safe. The vaccination policy will apply to all City of Mississauga employees. We will be asking employees to disclose their vaccination status beginning on September 15th, and employees will be able to disclose up until September 23rd. City of Mississauga Human Resources is currently developing a process for both employees and volunteers to provide confirmation of their vaccination status or request a human rights exemption, ensuring their confidentiality for medical documentation. Details on how employees will disclose their vaccination status will be shared with employees by our HR department in the next couple of weeks. Employees and volunteers who are not vaccinated or are without a valid human rights exemption will be required to take an education session and will have until October 31st to again disclose their vaccination status. If employees or volunteers still choose not to disclose their vaccination status or have not been vaccinated, they will need to provide the City with proof of a negative COVID-19 test before entering the workplace, starting on November 1st, 2021. We have and will continue to strongly encourage all of our employees to get vaccinated. If they are able, if they are eligible, they protect not only themselves, but all of those around them. Vaccines are the strongest protection a person can have against COVID-19. As an employer and operator of many facilities and frontline services, the City of Mississauga has a duty to create the safest possible working environment. We will continue to speak with our union partners and employees as we finalize the policy in the weeks ahead. At the same time that employers like the City of Mississauga are implementing vaccination policies, many other private and public institutions are also requiring their customers, clients, and students to show proof of vaccination. Last week, for example, we heard that both Live Nation and Maple Leaf Sports and Entertainment would be requiring people attending in-person events to show either proof of vaccination or a negative COVID-19 test. Many post-secondary institutions, restaurants, and retailers are asking for proof of vaccination as well. And I believe more and more businesses and organizations will be moving in this direction in the coming weeks and months. It has become abundantly clear that Ontarians need a safe and secure way to easily show their proof of vaccination in a number of different settings. Last week, I called on the Government of Ontario to implement a province-wide proof of vaccination program here in Ontario. This week, I am again urging them to do so. Health experts, chambers of commerce, and Ontario's big city mayors are all asking for one. I'm very proud that yesterday, my City of Mississauga Council passed a motion urging the province to create a proof of vaccination program. We need the Government of Ontario to step up and implement a standardized program that provides residents with an easy-to-download COVID-19 immunization record or proof of a medical exemption or of a negative test that can be stored on their phone or easily printed out. This may include either a secure barcode or a QR code that protects people's personal information and gives businesses and organizations certainty that they are dealing with a legitimate immunization record. It needs to be simple, easy to use, and universal. With a universal proof of vaccination, without one, we'll end up with a patchwork of apps and programs that will confuse people and won't protect public health. I'm not asking the province of Ontario to go as far as Manitoba, Quebec, or BC have done, with those governments requiring or mandating that residents show proof of vaccination to gain entry into many non-essential events and businesses. I believe at this time, businesses and organizations here in Ontario will put in place the right kinds of policies that will protect their employees, customers, and clients. But what we need is a standardized and trustworthy document that proves vaccination status. The current receipt that people receive after vaccination contains personal and private information, including your date of birth and your health card information. These receipts can be easily manipulated and falsified. The technology we're seeing implemented in other jurisdictions is simple and it's safe. We have to be realistic about what's going on in the provinces. Cases across Ontario are rising rapidly. We are in a fourth wave of the virus, driven by the much more transmissible Delta variant. In Peel and in Mississauga, we are now averaging 35 cases per 100,000 people, and that is more than a 100% increase in just 1 week. And this upward trend is happening all across the province. When I posted to social media about the need for a proof of vaccination program, I received thousands of comments from people. Most were supportive, but some were suggesting a proof of vaccination program isn't necessary because vaccinated people can still contract and transmit COVID-19. And yes, it's true that vaccinated people can still contract and transmit the virus. But let's be very, very clear. When you are fully vaccinated, you are less likely to contract the virus and much less likely to have severe symptoms and end up hospitalized or in the ICU. Out of the 103 recent COVID hospitalizations right here in the region of Peel, 101 were people who were either unvaccinated or only partially vaccinated. The other 2 cases were in fully vaccinated individuals who had a compromised immune system. This is a pandemic of the unvaccinated. This week, Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, also shared data on how effective vaccines are in reducing severe cases. unvaccinated individuals are 29 times more likely to be hospitalized due to COVID-19 and 48 times more likely to go into intensive care due to the virus. For now, our hospitals are in stable position, with 22 COVID hospitalizations and 7 patients in the ICU at Trillium Health Partners, and 22 COVID hospitalizations and 3 patients in the ICU at Brampton's William Osler Hospital. And we have to do everything we can to protect them from the situation that we were in earlier this year, when ICU capacity across the province was stretched to its limits, when elective surgeries were cancelled, and when many intensive care doctors feared that decisions would have to be made on who did and who didn't receive life-saving care. Businesses, organizations, and residents from all across Ontario want to help ensure that that never happens again. And now they need the tools. That's why the Government of Ontario needs to immediately implement a province-wide proof of vaccination program. It protects businesses, organizations, and schools from potential closures. It ensures that those who have chosen to get the vaccine will not be penalized with the type of extended lockdowns that we have seen over the last year and a half. It protects our doctors, our nurses, our frontline healthcare workers, our educators, and our students. If the province does not move quickly on a province-wide vaccination program, I am ready to work closely with Dr. Lowe and Peel Public Health on implementing one here, right here in Peel Region. But again, I believe a standardized, province-wide proof of vaccination program is more effective than a patchwork of programs and apps developed by regional public health officials and local businesses. And now, I would like to invite Dr. Lowe up to the podium for his update. Thank you.
Thank you, Madam Mayor, and good morning. In Mississauga this week, we are in a 4th wave of the COVID-19 pandemic. Rates are at 35.4 cases per 100,000. Test positivity is at 3.4%. Hospital admissions are climbing again, driven by individuals who are unvaccinated and those with just 1 dose on board. I welcome Mississauga's decision announced today. I'm glad that the city, as a prominent public sector employer, has weighed the risk of disease transmission in their workplaces and is determined that the implementation of a vaccination policy would help to offer protection to their staff and more broadly to our community. The decision to enact a policy of this nature sends a strong message, affirming that full vaccination is one cornerstone in our battle against the Delta variant. However, as we move into this turbulent 4th wave in our community, it is vital that we not only get vaccinated with 2 doses, but also start to reduce risk by reducing contact and adhering to precautions. This is to protect those in our community who have not yet had the opportunity to be vaccinated. As Mississauga has done today, I again repeat my strong recommendation that all employers in our community review if and how immunization can be incorporated into your COVID-19 workplace safety plans, especially if your sector has seen high transmission of COVID-19 in the past. And as for our residents, I again urge all of you, please, to get vaccinated with 2 doses for your own health and well-being and of that of our community. The vaccines are safe and effective. 2 doses will significantly reduce your risk of hospitalization and death from COVID-19. They do not change your genes, and they do not affect your fertility. mRNA technology has become increasingly established over at least a decade, which is why scientists were able to get an effective COVID vaccine to us so quickly to offer this protection. So please, if you are one of the 250,000 residents who hasn't had a dose yet, I encourage you to talk to someone you trust who got vaccinated about their journey. It might be a friend, your family, your physician, or other healthcare provider. You can also consult trusted sources like our website at peelregion.ca/COVID-19 vaccine. You can also use that website to book an appointment or to find a clinic location to walk into. For the other 150,000 residents that have gotten a first dose but have yet to get a second dose, please don't delay. We are seeing undervaccinated individuals also present to hospital. And with Delta surging, it is vital for you to get protection from 2 doses as quickly as possible. Remember also that eligibility has changed in Ontario and that anyone who was born in 2009 or earlier is now eligible to access vaccination. This means that 11-year-olds who are turning 12 this year can book or walk in for their first dose of protection at any of our clinics before the school year starts. In the meantime, for all of us regardless of vaccination status, we must continue to follow precautions and start to reduce contacts again, with so many school-age children remaining ineligible for vaccine and so many eligible residents still unvaccinated. We need to do so to limit the extent of the 4th wave in hospitals and intensive care units, especially as they are trying to catch up on service backlogs. We know that overwhelming hospitals risks everyone's health, especially as we all know and love someone who needs care, urgent or elective, COVID or non-COVID. So our measures on gatherings and events announced yesterday are anticipated to go into effect tomorrow and will help achieve this goal by facilitating timely contact tracing. But I need all of you, all of us, to be the difference. Please continue to mask and distance where possible in public, especially indoors, at large events, and in any crowds outdoors. Please consider connecting virtually and working that way if possible. Please ensure that you aren't meeting others if you're sick, even in the slightest. Get tested and self-isolate instead. Please get vaccinated with 2 doses as soon as possible, and please continue to be kind and respectful for our staff in clinics, on the phone, and out in the community. They're looking out for yours and everyone's well-being. We've stepped up before, and I know we'll do it again. I want to thank the community for doing their part, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. I understand there was a large explosion at the Kabul airport this morning affecting a number of individuals. We don't have any numbers yet, but my thoughts and prayers are with the Afghan people and the Afghani community here in Mississauga and the Region of Peel and the greater GTA. And now Dr. Lowe and I and Sherry Lichterman, who is our acting city manager, are delighted to take any media questions.
Your first question today comes from Lorenda Redekop at CBC News. Go ahead, Lorenda.
Hi there. First for Dr. Lowe, it
Sure.
sounds like there may have been some developments in terms of vaccine passports and the efforts by medical officers of health. Can you just update us on where things are at there?
I'd like to comment as well, but I'll invite Dr. Lowe up first. Thank you.
Yes, thank you, Madam Mayor. Thank you, Lorena, for the question. We are in the very early exploratory phases of trying to understand what our jurisdiction might be and also the nature of what a program might look like. It's important to clarify that it wouldn't necessarily be a vaccine certificate or technology in the manner that is being described. And of course, our preference would be that such a technology be developed at a provincial level, both to facilitate standardization and consistency across the province and also to facilitate intra-provincial travel and equivalency with other provinces that have a similar passport. For example, I know that people who have been vaccinated outside of Quebec and BC are being required to actually register to be able to use that vaccine certificate in those provinces. So it would be great if there was just an equivalent documentation at the provincial level. But absent which, we're looking at what are ways to use existing proofs of vaccinations to really encourage. And I think many businesses, understand that this is an important way to keep their staff and their patrons safe. It's also an opportunity for us to really try to avoid needing to apply broader measures to really keep our unvaccinated population away from harm and from severity and mortality. So we're in very exploratory phases as to what might be done in discussion with other health units, but hoping, of course, as the discussions continue to move as quickly as possible in the event that we aren't able to access this facility at a provincial level. Thanks for the question.
Lorenda, if I can, I just don't believe that this is a practical solution. I think we need a universal and uniform proof of vaccination that can be applied right across the province, not region to region, not by businesses, not by chambers of commerce. This must be a program developed by the provincial government, be universal and uniform, and be ready to be able to be deployed right across every business, organization, institution, and organization right across Ontario. Is there a follow-up?
Yeah, could you clarify then, with what the medical officers are saying, do you support them if the province isn't going to go ahead? And for Dr. Lowe, do you have any concerns about the legality of this?
So I absolutely support Dr. Lowe. I always do, and all the medical officers of health. And I think what you're seeing is their attempt to address a seriously needed situation that the province is not willing to address. So I thank them for taking this initiative, but I think the right course of action will be for the province to create a universal and uniform proof of vaccination program for all business, all organizations, and all institutions across the province. So with respect to the legality, he'll have to speak with that, and I'll invite him back up to the podium. But I applaud his effort, and I'm happy to work closely with him to create such a program, should it be necessary, should the province once again not be willing to create a proof of vaccination program that's universal across the province. Thank you.
Thank you, Madam Mayor, and thank you, Lorena, for the question. Legal aspects and, of course, ethics, ethical and equity aspects are all being part and parcel of the analysis that is ongoing. And, of course, I would not presume to speak to legal issues, given that I'm not a lawyer. But I think the more important message, however, is that one way or another, I think this is one way to really try to avoid needing to apply broader community measures. I think the reality is that in previous times where we had a largely unvaccinated population and a population that was susceptible to this novel virus, we needed to apply significant closures because we didn't know who was at risk of getting sick and we didn't know who was at risk of severe illness. We know now that people who are vaccinated have a reduced risk of getting sick and passing on the infection and a significantly diminished risk of severity. So now in this situation, especially when we're out and about with contact interaction between people, one of the safest ways to keep people who haven't had the opportunity to get vaccinated safe is to make sure that they are they're protected from potential high-risk activities, and that would include non-essential settings where measures cannot be consistently adhered to, such as masking and distancing. So it's for this reason that we're looking at any option that we can apply at the local level. It needn't be resource intensive, and I'm hopeful that our analysis and our conversations with other health units will continue to both arrive at something should we need to do it, but also perhaps to spur action with our provincial counterparts who I know are looking at this matter very closely as well. Thanks for the question.
Lorenda, just one more word on that. So I just think it's impractical that there be a patchwork of programs and apps across the province when it makes far more sense for one uniform program, much like other provinces have done. It's time for Ontario to turn their attention to this as well. We've seen it in Quebec, in Manitoba, in BC. So we're asking the Premier to please give this some serious consideration. It is coming, whatever format it may take, whether it's going to be delivered by the public officers of health or not, it should be delivered by the province. Thank you. Next question.
Your next question comes from Beatrice Vaisman at CP24. Go ahead, Beatrice.
Good morning. I wanted to continue the conversation on vaccine passports. Mayor Crombie, Dr. Lowe, perhaps you can both comment on this. Dr. Paul Remiliotis, the president of the Association of Local Public Health Agencies, today telling my colleagues at CTV News that a discussion happened yesterday with all of the medical officers of health across across the province, pretty much everyone is unanimous in the need for this vaccine passport and in going it alone if the province does not implement a broader program. So I'm curious, how long is Peel Region willing to wait and see if the province is going to come forward before you decide we're going to go ahead and do this? Kind of like you set this October 31st deadline for vaccinations for city workers. What is the deadline to decide whether you're going it alone for vaccine passport?
Well, I'm going to let Dr. Lowe respond to that, but certainly I think this is something that we've been anticipating and he's already given some thought to and probably already started the work on. Knowing Dr. Lowe, he's always very prepared, but I don't like the characterization of it as a passport, Beatrice. I think we need to move away from that nomenclature. I think what you want to call it is a proof of vaccine program or system or app or whatever it may be. Let's get away from the word passport. You know, there will be the ArriveCan app, federally be used for travelers, and that's not a passport either, and this shouldn't be considered a passport. It should be considered a proof of vaccination record or an immunization record, but there needs to be a program that is uniform right across the province. It's easy to deal with. It can be a QR code or a barcode that has all the vital information on it, when you were vaccinated, the dates that you were vaccinated, whether or not you have a medical exemption from a vaccine, and or you can even include the last date of your negative test result. You can include that all on this proof of vaccine record, shall we call it. Dr. Lowe, over to you on the timing. Thank you again.
Yes, thank you, Madam Mayor. Thanks, Beatrice, for the question. Certainly that meeting, my recollection is certainly as you said it with the first part, which is that obviously we would prefer, I think, medical officers of health around the province, myself included, would very much prefer if a consistent provincial approach and instrument were used. I think it really allows for consistency, both in terms of settings where it may be applied, in terms of how it might be developed and distributed, and I think that's really my recollection of that, rather than the idea that everyone was willing to go it alone. I don't think that's a fair characterization. I think certainly, like I said, for us in Peel, we recognize the value, especially having been one of the hardest hit municipalities and the need to apply broad community measures here for as long as we have. At this point in time, we are seeing a fourth wave. We are seeing a more transmissible, more severe variant really start to propagate within unvaccinated and undervaccinated populations, and these people need to be protected, especially from potential settings where there will be high risk, where they may be, especially as the numbers continue to grow, a risk that they may be exposed and subsequently may experience a severe outcome that would impact hospital and healthcare resources. So ultimately, this is about keeping the unvaccinated people in our community safe. It is about keeping our businesses and our organizations open, because ultimately we do know that closures have also had impacts on broader health and well-being. It's about really trying to reduce risk in these settings by making use of the science that we know, which is that if you're vaccinated, you are at a reduced risk of infection and you are at a far less risk of severe outcomes that may require hospital usage. Thanks so much for the question.
And Beatrice, just before you follow up, let me just add that we're seeing more and more, whether it's restaurants or retailers or post-secondary institutions or other organizations, live concert events like Live Nation, now MLSE and other event providers are requiring a proof of vaccination or negative test result. So this needs to be standardized, and it needs to be provided for everyone. Easy to use, downloadable, because it's just the right thing to do. It's a more practical approach than having a patchwork of programs and apps right across the province. Next question or follow-up question?
Yes, I've got a follow-up on the mandatory vaccination for city employees. I'm curious why the routine testing has been left on the table as kind of a fallback if someone opts not to provide proof of immunization by Halloween. Why is that, I guess, a good way to move forward? And what does routine testing mean? How frequently will someone be tested if they opt not to be immunized?
So let me first correct you and say we are calling it a vaccination program. It is not a mandatory vaccine program. It is a vaccination policy and a vaccination program right here at the City of Mississauga. That you're quite right. We are asking our employees to disclose and begin the disclosure process on September 15th right through to the 23rd. After that, there will be an education session, an education process that everyone who has not disclosed or is not vaccinated will be asked to participate in. And following that, they will have another opportunity up till the 31st to provide proof of vaccination. We're hopeful that after the education session, there will be more uptake on the vaccine. And following that, yes, to come to work on November 1st, you will be asked to provide a negative test. And there will be regular testing. It is not all defined yet, but you will be asked to come to work with the negative test result. And I have our acting city manager, Sherry Lichterman, who is our Commissioner of Corporate Services and our CFO, and she has been hands-on in developing this policy, and I'm going to ask her to speak to it as well. Thank you, Beatrice. Sherry?
Thank you. In regards to your question relating to why did we choose to go with routine testing as a final escalation for those who aren't vaccinated, really that was based on our review by our legal team, our city solicitor. As a government agency, we have certain obligations we have to meet with respect to a policy like this and our employees. So certainly mandatory disclosure, and we want to encourage all of our employees to be fully vaccinated, but we are allowing for this escalation of education and then ongoing testing as a way to mitigate for those who aren't vaccinated and for those who have legitimate exemptions from the policy. In terms of the testing program, that's still in development. There are many organizations who are now going to be moving to this type of testing, and so over the coming weeks we will be finalizing that and communicating that out to our employees. Thank you.
Thank you. Next question or follow-up? I mean, we do have a legislated obligation to provide a safe working environment for everyone. And I think that's the underlying root cause of the new policy that we've put in place.
Your next question comes from Francine Copin at the Toronto Star. Go ahead, Francine.
Welcome, Francine. Thank you for joining us today.
Yes, thank you. My question is for Dr. Lowe. Dr. Lowe, Dr. Paul Remiliotis is being quoted as saying that the medical officers of health in Ontario agreed on Wednesday to create their own proof of vaccination certificate in each jurisdiction. Is that accurate?
I'm going to invite Dr. Lowe to the podium, but if I may just say that, you know, this is this certainly program of patchwork of programs and apps and this ad hoc solution that the medical officers of health have come up with, and I applaud them for doing so, but it should not replace a universal and uniform vaccination, proof of vaccination program that the Ontario government must implement, as other provinces have to date. We've seen it in Quebec, Manitoba, and BC, and it's now time to create such a program right here in Ontario. So Dr. Lowe, over to you.
Yes, thank you for the question. So as per my previous answer, that's not how I would have characterized the position of the medical officers of health. However, they were unanimously, I would say, in agreement that a provincial solution is desirable for consistency and for application. And I think many of the medical officers of health are, certainly view a time-limited vaccine certificate as an opportunity for us to get through this turbulent period where you have large numbers of people that are vaccinated who are at lower risk of disease, and you have large numbers of people who remain unvaccinated and haven't had the opportunity to access the vaccine, who may be at more risk in certain higher risk settings of potentially contracting the illness and then potentially having more severe outbreaks. I think the reality is, in the past, we used broad closure and curtailment measures because everyone was susceptible and nobody was vaccinated. Given our current state and our situation right now, it is clear that we already have now different segments which we can use to our advantage to try to keep our communities open with a proof of vaccination system. Thanks so much for the question.
I have a follow-up question.
Yeah, go ahead. We've got to congratulate the medical officers of health to come up with what is a very commendable solution to a much-needed program in the absence of the existence of such a program, and that's why we're calling on the provincial government to create it so that it's uniform right across the province. But we got to thank the medical officers of health, and we're all the mayors are willing to work with them to establish and create this in the absence of what's required by the province.
Thank you. So my follow-up question is for Dr. Lowe.
Okay.
I'd like him to clarify something he said earlier about how we are in the early exploratory phase of looking at a vaccination. I mean, you don't want to use the word passport, but a proof of vaccination system. When you said we, did you mean your region, or do you mean that all medical officers of health? It's your understanding that all medical officers of health around the province are also engaged in these first exploratory steps.
Yeah, my comments on this matter should be construed to come from my role in speaking as the medical officer of health for the region of Peel, and should not be construed to come for those of my colleagues across the province. For their viewpoints on the matter, I would encourage you to speak to them. And then certainly for the viewpoints of the Council of Medical Officers of Health as a whole, Dr. Charles Gardner in Simcoe Muskoka is the chair, and he would be the one to speak as to COMO's views. So I appreciate the correct attribution. Thanks so much.
Thank you. Next question, please.
Your next question comes from Shauna Hunt at City News. Go ahead, Shauna.
Hi there. Good morning. So
morning.
I do want to stick with passports. Just another question for Dr. Lowe.
Sure.
I guess my question is Peel Region working or exploring this possibility with other health units in the GTA, Toronto, York, Hamilton, and so on? So if you could answer that, and also, would it be possible for all the health units in Ontario to come together and create one system that's more standard and universal? Is that something that's possible?
Well, I think it's very difficult for 34 health units, especially health units that are actively in the throes of a fourth wave response, to pool our resources and to be able to align and coordinate and bring together our various local contexts in trying to identify settings, what you do with ineligible groups, all these other pieces. I think that's a very challenging proposition. Ultimately, we are seized with the situation in our own communities and what needs to be done. Certainly, we are communicating with other health units that have expressed an interest in this, but I think our big focus is really, at least for us in Peel, a recognition that our community has bore the brunt of this, and we certainly don't want to see a return to broad closures, and that's why one of the most important things to do, at least in the short term, until we get to, the reality is we need this until the virus is no longer novel, and that means it become endemic, and everyone has been exposed to it in one form or another, either through vaccination or through infection. And with the way the fourth wave could potentially spread, especially through unvaccinated populations, I think Dr. Peter Uni often characterizes it this way. He says, there's the easy way, which is get the vaccine, and there's the hard way, which is get infected, and you never know. It could be a mild infection, it could land you in hospital, or worse. So I think that's really the issue that we have here, is that we now have a situation where it's no longer, I don't think, palatable, although we certainly wouldn't shy away from it if necessary. It's no longer palatable to have broad community closures and to treat all people in all settings the same. Now that we have vaccination, and now that we know that there are certain settings that are high risk, why wouldn't we try to essentially use our high vaccination rates to our advantage to keep our businesses, to keep our societies open, to keep our unvaccinated individuals, the people who haven't had a chance to access vaccination yet, protected, and really help to reduce the risk for all of us ultimately through what is potentially going to be quite a severe fourth wave. So I think that I hope that clarifies my position.
Sure. In quick follow-up for you, a different topic. Toronto District School Board today announced that it will be mandating vaccines for teachers, staff, visitors to the school. And I'm just wondering what type of advice you're giving to Peel, to school boards in Peel Region. Or do you believe that the educators and teachers and staff should have mandatory vaccines?
So as I stated yesterday at my press conference with Mayor Brown and repeated today, Peel Public Health's position is that all employers should look at vaccination within the auspices of a COVID-19 workplace safety policy and conduct a risk assessment to determine how vaccination could continue to be one part of ensuring a safe work environment for their employees in line with their mandates under the Occupational Health and Safety Act. That's the specifics of a policy are beyond my comment in Peel Public Health, because the best people that know their business and know how to keep their employees safe is the employer, and that's stated in provincial statute. Thanks for the question.
Thank you. Next question, please.
Your next question comes from Steve Cornwall at the Mississauga News. Go ahead, Steve.
Mayor Crombie.
Welcome, Steve.
Just a question around the testing piece for the city policy on vaccination. Will the city be doing the testing, or is it considering doing the testing itself? And I ask because if you're asymptomatic of COVID-19 now, it can be a challenge to get a regular test, is what seems to be the request is here from the city.
So, Steve, we're still working out all those details, but the employee, as of November 1st, will be asked to provide a negative COVID test before coming to work. I'm going to ask Sherry Lichterman to elaborate further. Sherry?
Thank you. Good morning, Steve. Yes, as I said earlier, and as Mayor Crombie just said, the testing program is really still in development, and so we will be working with many other organizations and partners to determine the most efficient way for our employees to be tested. I anticipate, it may be something different from the standard protocol that people are using right now for testing for travel and other needs, but that is still in development, and we certainly want to make it as seamless and easy as possible. And we do anticipate that there will be quite a bit of demand from employers to have a simple way for testing to take place. So we'll be working on that over the coming weeks, as I said. Thank you.
Follow-up?
And just a question, perhaps a question for you, Mayor Crombie,
Sure.
and perhaps Sherry as well. But
Sure.
You mentioned earlier that valid human rights code accommodations would be accepted by the city.
Yep.
Can you tell us how employees' human rights code accommodations are being verified?
Yes. So human rights exemptions could be medical or on religious reasons, and they will be evaluated on a case-by-case basis. And Sherry, is this something you would like to elaborate on? These will all be on an individual basis, but typically for medical reasons or for religious reasons, Steve. Sherry, over to you.
Thank you. I would just expand on that to say that as with any medical issue with our employees, we have a group of employee health services staff and a medical doctor who leads our occupational health and safety team, and that is who would be gathering the records from employees and assessing any exemptions. So that would all be done following privacy regulations and be dealt with by our employee health services staff. Thank you.
Follow-up, Steve?
That was Steve's follow-up.
Okay.
Your next question comes from Isaac Callan at the Pointer. Go ahead,
Welcome,
Isaac.
Thanks, Mayor Crombie. During the last federal election, the city had to cancel its Mississauga Matters debate after it was unable to confirm candidates. Since you're rolling out the Mississauga Matters campaign again, are you going to be trying to hold another debate for city candidates? And if not, why not?
Yes, so you're quite right. We are running our hashtag Mississauga Matters campaign. We have sent briefings to all the local candidates and to the leaders. And of course, we take this opportunity always to meet with our federal members and all the candidates. With respect to the debate, we have not yet planned a debate, Isaac, and I'll have to follow up, but I don't believe there is one. As you know, this is only a 36-day election, and we are in the midst of a pandemic, and we're worried about so many things right now, including our new vaccination policy here at the city. So this wasn't something that we had planned to do, but I'll follow up with you should I be incorrect.
Okay, and I'll wait for that follow-up. I ask because, the idea that Mississauga matters, it's important that candidates are able to share their views on the city, and giving up, 1 or 2 hours to talk about a citywide debate would suggest that they think Mississauga does in fact matter. Have you given no thought to a virtual format or outsourcing it but giving it the city's branding? Is there no debate whatsoever? Are you thinking outside the box on that at all?
Isaac, you're challenging me on this. I have to tell you that because of COVID, we have been consumed with proof of vaccinations and vaccination policies and our operational deficit, and getting our message out, the Mississauga Matters messages out to the candidates that are running here in Mississauga, but we had not turned our attention to hosting an online or virtual debate. So I will go back, but I'm not sure there will, time permitting. It's we're already into week 2 of the campaign. There may not be sufficient time to host it. These are often hosted as well by resident associations and the Board of Trade. So we'll see if anyone has debates planned, but at this time, the city does not.
Your final question comes from Delkin Finucane at Mississauga. Go ahead, Delkin.
Welcome.
Delkin, are you there?
Do you have a sense at this point how many city employees are currently fully vaccinated, and moving forward, how many city employees do you anticipate will be back working on site as of November 1st?
So I am going to let Sherry respond to this, but what I do know is that we don't know the answer to that question, and that's why we're asking for full disclosure starting on September 15th. We know that about 85% of our residents here in Peel have had their first vaccine, and we're 70%, Dr. Lowe? 70% fully vaccinated. So, if you apply those same statistics, it would tell you that about 85% of our employees are 70% are fully vaccinated. But we will be asking for a full disclosure beginning on September 15th. And what was the second part of that before I asked Sherry to respond?
Yeah, it was just how many, if you have a sense, how many employees would you expect to be working on site as of November 1st?
Right. So I think there will be a gradual return to work. Not everyone will come back at the same time, and not everyone is front-facing with the public. Not everyone is required to come into the office to work. Many will continue to work from home, and I know that we are staggering people to return to work. And Sherry, I'm going to bring you back to discuss the return to work policy here at the City of Mississauga. Thanks for that question.
Thank you for the question. So the City of Mississauga, if you include all of our part-time employees, has over 7,000 employees. About 2,000 of those employees are office-based and have been working remotely throughout the pandemic. So you can see that leaves, somewhere in the 5,000 range of employees who are working at our work sites across the city. And that, of course, highlights the need for them to be fully vaccinated as they are out there working with the public and working with each other at our work sites. As it relates to the approximately 2,000 who are working remotely, we are gradually planning for them to return back to the office on a hybrid schedule. But of course, we're doing that very cautiously based on the case counts and the recommendations from public health. So we anticipate it'll be a few months before we really see a regular return to the office. Hope that answers your question. Thank you.
Yes, thank you.
Is there a follow-up?
No, thank you very much, Bonnie.
Okay, terrific. Thank you. Are there any further questions?
That's it for today, Mayor Crombie.
Oh, okay. I thought you had mentioned Khalid from YTV.
Yeah, I don't see him online anymore, unfortunately.
Thank you. Well, thank you for joining us today.